All right, welcome everybody. I'm Wes Warren. I'm here with Greg Stanley. We're from Whitehall Management, and we're going to be talking about today characteristics that we look for in an associate. And we picked three, and these we feel are three of the bigger ones, certainly ones that we get a lot of questions on. We've hired for doctors for years and years and years, interviewed, hundreds and hundreds of associates over the years, probably into the thousands now. And obviously, we've kind of learned what kind of associates work out and which don't. And we have our own method as far as what we want to figure out in the interview process. So we picked three, and that's what we're going to cover today.
I might add that that's about the same number that we tend to use in hiring a staff person. If we get too many characteristics, we tend to limit it to about 3 or 4. The characteristics in a staff person, if you get too many, you can't find anybody that fits the bill. Same with associates. So the key things, in other words, the things you just, they're deal breakers if you don't have them, or you do have them, or whatever. That's what we're going to cover today.
Yeah, I would say the first one, probably not a deal breaker. I wouldn't call this a characteristic. This would be more of one of the questions we get a lot, and it's basically, what should I hire somebody new, somebody just graduate, or should I hire somebody that's, kind of at their retirement, really seasoned veteran that really knows what they're doing, or should I find somebody, that's been out 4, 5, 6, 7 years? What do you see work best? And again, that's a little bit of a loaded question because it really depends.
Let me give you an example of what I've seen. I've seen experienced doctors moving from one part of the country to another. I've seen that work out. Hopefully they're not at the complete end of their run where they're more likely to retire than the doctor that's hiring them.
Yeah.
As to brand new doctors right out of school, I want to tell you what I have experienced and learned. If the doctor is at the top of their class, really excellent scores in the difficult classes, they have a tendency to learn so quickly they can catch on. In other words, I have some people that have done well with brand new students. They're right out of school, but they're super smart. And you'd think anybody that can get through dentistry is super smart. Well, I'm sure they are, but smart enough to learn on the job, at a dead run. The people that have top grades tend to be quick studies and catch on quickly in your office. And so, yeah, we like experience, and we also like people that learn quickly.
We have a lot of people that hire right out of school, and it's not a deal killer. It's not but as we were talking about before we started the recording, Greg, we were saying that the doctor really kind of has to be set up to want to spend a little extra time, doesn't mind, somebody taking a little extra time coming up to speed. You might have some extra capacity that the operatories aren't so crucial that we utilize every operatory in the office to maximum capability. And the doctor doesn't mind mentoring a little bit. We're not at a pace where the office can't, I don't want to say slow down, but take a minute and help a doctor out, a new doctor. And so you've got to know who you are and your office and your patients, whether that type of person fits in. The next category is, let's jump to somebody that's retiring doctor or semi-retired doctor, the moonlighting doctor that kind of fills in. Certainly see that work. I would say I'm less impressed with this one. They tend not to be as motivated. They kind of just I don't want to say punch the clock, and they're very set in their own ways and want to do everything their way. They want to, so they're not moldable to. So if you're really wanting things done your way and materials and everything done your way, and you have a certain way you want to treat patients that might conflict a little bit, you can find this a little bit difficult, hiring somebody that's really seasoned. Those would be kind of the things I would be concerned about, especially in the interview process. I want to definitely figure those things out. Are they flexible? We tend to see the bulk of our dentists, kind of newer dentists. They've been out 3, 5, 8 years. Really, I use the word, really haven't been synced roots in a practice yet. The better the dentist, obviously, the quicker that's going to happen. So anybody that's been out for 15 years, 20 years, if they're coming to you, I'd really want to know why. And there could be a good reason, but I'd really want to know why, because a good dentist should have sunk roots somewhere and really established themselves. So those are kind of the things that we look at in terms of experience and our rationale.
I would say that if we could talk to the owner that's going to hire somebody, and then if we could talk to the prospective associates, we could probably match them up pretty well. We're trying to impart to you the same wisdom we would use. And I know there's a lot to it.
Right.
Associates, like other employees, tend to say what you want to hear, but there's certain things you need to bear down on. Telling an associate, we need somebody who can really learn to do endo or learn to do this or that. And they say, yes, I've always wanted to do that. And you hire them and their effort seems so minimal toward perfection, toward excellence, you're never going to get there. So they really have to have a hunger for the dentistry you can offer them. So new versus used, new doctor versus somebody in the market. I think there's less risk hiring somebody that has some time in country, treating patients. Less risk. I do worry about a number of things. One is if the person's experience was in a clinic setting, meaning not a private office, but maybe a government clinic or a big office, a big mill. A lot of times we find doctors that have been just doing one procedure or whatever they do, they take too long because they're allowed to. They're doing dentistry for next to nothing for somebody in this clinic. And they come on to you and you're a for-profit office and the pace picks up. So these are things you have to look for. Not that they're deal breakers,
right?
But you definitely have to figure on. I think of a case that we had where a doctor failed. He failed the owner. The owner just threw him in, said, you know how to do endo? And he said, yeah, I can do endo. And he had been working in a clinic setting for, free dentistry, and it failed. He got halfway through the procedure and didn't know what he was doing. The owner had to step in. It was a mess. I really think it's worth looking at some of their work and not just listening, because I know one of my clients told me that he hired a doctor who said, yeah, I can do endo. I did an endo when I was in school. That was it. So there's more to it.
The clinic thing that you brought up, I think, our experience has been if they spend too many years in that kind of setting.
Oh, yeah.
Once it starts to get into like years and years, we do notice that could be a problem. It's definitely something to watch out for. I will point out, as in terms of what I've looking at their past work, they should present you cases, and obviously this is their best work. They're not going to take pictures of stuff that isn't. Their best work should look like it. It should look perfect. So if you see anything that they present to you that's just marginally good, that's a bad sign. When they're presenting you their work, they should be hand selecting you their best cases. And so it should look perfect, flawless, their work.
Okay, what's number 2, Wes?
Okay, number 2, and this is a deal breaker. So this is one of those things where if this doesn't match up correctly, it's a deal breaker. So this would be case presentation style. I'll call it style. And we're going to put it on a continuum of assertive or conservative. Obviously, there's people that are hyper conservative, almost to the point where you'd say we got a problem with how conservative this is. And then we have that the opposite, where it's hyper assertive, where everybody is being presented $8, $12, $15,000 worth of dentistry. Every patient is being sat down and wined and dined to do huge cases. And then there's everybody in between. Okay, so you've got to know where you fall. And if you don't know, ask your staff, where do you think I fall? Would you say I'm mildly assertive with my presentation or how I present dentistry, or would you say I'm conservative? If you're uncomfortable watching teeth and that you feel a need to present everything all at once, you're moving in the assertive side. So you've got to figure out where you stand here, and you've got to figure out where the doctor you're interviewing stands. And what you can't have is a mismatch. Okay, so absolutely a deal killer if it's a mismatch. You're assertive, they're non-assertive. You're non-assertive, they're assertive. You've got to be close here. It can't be completely polar opposites. So what we see happening when they're opposites. So take an assertive doctor brings in a non-assertive doctor. Assertive doctor is able to take a handful of patients and do very well off of them. And you bring in an associate and a handful of patients, they need a truckload. They need like a different style of practice. They need not an avalanche of patients, but completely different to succeed with that type of personality and case presentation style. And vice versa. So you get, if you're a conservative dentist and you've cultivated that type of practice, these patients have expected this type of treatment planning, and you bring in a shark that comes into your patient base, and I don't want to say over treatment plans, but is real assertive with them, it's not good. You get a rejection of this person. The patients could flee the practice. We've seen absolute devastation there.
Can I make a comment about this whole concept of style?
Yeah.
From assertive to non-assertive. When you get too much space between the two, they're too different from you, whether you're highly assertive or highly non-assertive, and you try to get them to come to your side of the table. What tends to happen is when they're not being observed or pushed or overseen by a knowledgeable staff person, they revert. There's an old song, I've got to be me. I don't know if you remember, there's no singer sang this song, I've got to be me, like that meant something. I always say you don't have to be you need to be me. You need to be more like the office, more like the doctor that you're working for.
Right.
But they have a tendency to revert. We have the same problem with staff. When staff come in, it takes so much management and oversight to bring them up to where they need to be. You turn your head and they're back to letting people leave without paying and so forth. Just be apprised. This was worth your time watching today. When you find somebody who has this big spread between who you are and who they are, but they're very, very willing to change, make no mistake. The odds are somebody's going to have to be full-time sitting on this person to get the outcome you want.
Yeah, they're going to just revert back to who they are. Yeah. So get a good sense of where you fit. So if you feel like you're middle of the road, you got to find somebody else like that. So find out where you're at and definitely make this part of your interview process.
This is one of the problems we actually find in dentistry. When somebody comes to you and they've been in practice before, and now they're not in practice, why not? Sometimes they were too assertive or they were too non-assertive. They tried to oversell people or they couldn't give it away, one or the other. And so this is a good a red flag for you when they come to you and say, yeah, I was in practice, so it didn't work out. And now I want to be an associate. In other words, they're saying, I want you to feed me patients as an associate, but I'd like to kind of treat them the way I always have. That doesn't work.
You can also ask probing questions about how many new patients do you typically see, where you're at, what's your average production per month, How many hygiene checks do you see per day? And kind of reverse engineer that with your practice and see where they're lining up with, patient value, what they get out of a patient. And you can figure this out. You can figure out, are they a good match for what you guys do? So definitely that's number two, and this is a big one.
Wes, this is something I've noticed when we watch doctors open additional practices. You've got an office, the mothership, and they would open satellites and bring new doctors and put them in there. Something that became clear to me is, especially through when you're marketing these people into the office, these people aren't easy to work with. They are not easy to work with. They bring up all kind of objections. They're critical. They're even abusive. And so when we're talking about adding an associate doctor, they've got to have a little bit of a tough skin. They got to be quick on their feet, and they've got to know that this is part of it. Some of us got into dentistry dreaming of people coming in saying, "What should I do, doctor?" "Oh, a whole mouthful of dentistry." "Oh, that's what I wanted to know. Thank you." And that seldom happens.
Yeah. Okay. And point three. Okay. So if we can move on to the last thing on our list today, would be we're trying to find somebody that's teachable, somebody that's moldable. There's different words for this, flexible, but in essence, with some humility is what we're looking for. And there's a lot of different interview questions that can pull this out. But one of the ones that we really like to try to get this going in this direction is to find out what their career goals are, and to really get them to talk about where they see themselves in 5 years, 7 years. And a lot of dentists will be pretty vocal about being an owner, being a partner of some kind. And you want to ask timeframes. You want to really get, how important is that to you? What kind of time frame are you looking for? Now, it is also very important that you do not lead the witness here. So when you're doing the interview, you do not let them know that you're looking for a partner or not. So they have no idea when they're answering this question where you are at. And I don't really care where you're at. It doesn't really matter to me. But when you ask this question, what you want to know is how keen are they for ownership? And you want to see if the fangs come out. Like, 2 or 3 years, definitely it's really what I want to be. I want to really be an owner. And you really want to, okay, what's important to you about that? Why is that so important to you? And you're looking to hear how much control they want. And people that really want control aren't very humble. They're not very flexible. They're not people who want to join the team and really learn from you. They feel like they want to teach you. They want to take control of this practice and double it. They're smarter than you. You're doing 8 things wrong. I can find 6 things. And they have this sense of wanting control and wanting to conquer the world. And you don't want that type of person in your practice. Question and say, yeah, I'd like to own. Yeah, it's 3-4 years. Yeah, but you don't feel a passion behind it. That's somebody that's really passionate for ownership. Unless you're offering ownership in the next 6 months or a year, I'd avoid this person.
Let's talk about speed a little bit. How fast they are, chairside. We seldom find a doctor who's not really committed to quality. They've talked about it in school until they're sick of hearing about it. They all agree to it. They believe in it. It should all be quality dentistry. Yeah. So when they find out how long it takes you to do a quality crown, filling, or whatever, they're actually gobsmacked. They can't believe what they just heard. So make no mistake, though quality could come up later, it's going to be speed that gets us. And a lot of times, like I was talking about earlier, they failed somewhere else. It's because they probably were very good, but they couldn't go fast enough to make money. And so when you said, Wes, humble, teachable, they've got to learn to go faster. And you're going to have to coach them, watch them and see what they're doing.
they gotta be humble enough to learn from you. Yeah, I mean, if they already think they know everything and that they should be teaching you stuff about how to do dentistry.
What they may be able to actually teach you is how to go broke in a busy practice.
Yeah, yeah.
And it's something you probably already know.
And so you definitely want to look for this. This one's a subtlety in trying in interviewing them. You want to ask them, is it, we have leadership, this manager, she may be, in charge of you. How do you feel about that? You want to, well, it's okay, yeah, or, oh, I thought we would be on the same level.
Yeah.
You kind of want to set a tone where that's not how it works here. You're still, you want to set a tone to see how they respond, even though that may be how you want to do it. I don't recommend that, but if that's the way you want to do it, that's fine. I'm not going to argue with you, but you want to see how they respond when you push them a little bit and say, hey, you are going to be, she's going to be in charge of you. You'll be answering to her. How do you feel about that? And see if they're kind of okay with that. This really kind of pulls out this humility stuff.
That tells you whether they're humble or not.
Right.
I want to go back to something, we talked about speed. I remember seeing a business card that a fellow had, and on the back of it said, do you want it fast? Do you want it cheap? Or do you want it done right? Pick two. And so that's where associates tend to fail. It's where they tend to end up failing on their own. They can either do things fast and do it crummy, or they can do things slow and do well. We need people that understand from the get-go. You will not have succeeded here until you're fast, almost as I am, and do the same quality.
Yeah.
So they need to be aware of that and acknowledge it. And now they're going to ask you, how did you get fast? Part of it was having patients waiting, feeling the pressure. So they've just got to know that we're going to be judging them. Typically, our old rule is in 4 months, they need to be producing, around 4,000 a day.
Yep.
So, yeah. And if the work's bad, they're gone.
Absolutely.
So there it is.
Yeah, those are the 3 things that we wanted to talk about today. Obviously, there's other things we look for, but these I would say are the 3 big ones, and there's 2 of them that are deal killers for sure. The last 2 we talked about. If anybody wants help bringing on an associate or wants a little advice about their practice, we are obviously taking phone calls from doctors, but we do ask a favor. We'll give up an hour of our time and give you everything we got in terms of answering any questions you have, helping the practice out. But at the end of it, if you like the hour, all we ask is that you go online and give us a Google review. We'd love to do it, but that's the only thing we ask for in return. So if you're interested in our help, you can talk with Greg and myself about these topics or anything to do with practice, really. And if you want to take us up on that, all we ask for is that you leave us a review.
Thanks for listening, everyone.
Thanks for listening.